right, perfect. 3, 2, 1, and we are live.
Good afternoon, everyone. My name is Matthew Vino. I'm the Executive Director of the Group Insurance Commission. We're grateful that you've joined us this afternoon. This is the first of 3 public information sessions that the GIC will hold this week. This is an important part of the process for us to finalize the design and premium rates for our health insurance plans for the coming annual enrollment. We are holding these sessions virtually by Zoom and also live streaming on YouTube. And we will post the video of this session on the GIC's website at mass.gov/GIC. Our plan this afternoon is to do a 30-minute or so presentation followed by a Q&A session. I will be joined by Erica Schabelli, a key member of the GIC's leadership team, who will assist with logistics. And I'm also joined by a number of GIC senior staff who will help with the Q&A portion of the session and any questions that we get. I also just want to start with a few housekeeping items. Your participation in this information session is not required for you to participate in annual enrollment. This is completely voluntary and for informational purposes for you. We also have closed captioning, which will be embedded in the stream, as well as a link provided in the Zoom chat. And if you'd like to utilize ASL, American Sign Language, that information will also be available to you in the chat. So on the next slide is our agenda for today. We're going to start with a brief overview of the Group Insurance Commission and our carriers that we work with. Many of you will find this very familiar, so we won't spend too much time on that. A little bit about who we are, what our role is, how we operate. Then we'll talk through what you can expect in the upcoming plan year. And we will end the session by responding to questions and comments that we've received during the session.
Hey, Matt, I'm sorry to interrupt you. While we are live streaming, the actual Zoom participants are just joining now after Emily clicked start webinar. So if you don't mind actually just going over that, that would be helpful. Sorry about that.
Happy to do that. No worries. Forgive me, those of you who have already been on. My name is Matt Vino, Executive Director of the Group Insurance Commission. Thank you all for joining us. This is the first of 3 public information sessions that the GIC will host this week as an important part of the process to finalize our design and the premium rates for our health insurance plans for annual enrollments. So we're holding these by Zoom and also live streaming on YouTube. Thank you for joining us, those of you who are there. And we will post this and all the other materials that relate to it on our website at mass.gov/GIC. Our plan is to do about a 30-minute presentation, and we will have after that a question and answer session. And we're joined by Erica Schabelli, a key member of our team at the GIC, who will assist with logistics and a number of other GIC staff. A few housekeeping items to note at the outset. This is a completely voluntary session. You're not required to do this to participate in annual enrollment. It is for your informational purposes only. And we also have closed captioning for this session, as well as American Sign Language. The closed captioning will be embedded in the stream, and you can find out information on how to access American Sign Language through the chat. On this slide, we see our agenda for today. We're going to start with a brief overview of the Group Insurance Commission and our carriers. Many of you will find this very familiar. We won't spend a whole lot of time on that. Then we'll walk through what you can expect for the upcoming plan year, and then close by taking a number of your questions and addressing comments. So you may submit questions at any time during this presentation using the Q&A tab, typically at the bottom of your screen. We will be reviewing your questions, and we have staff on hand to respond to them real time right in the Q&A tab. As always, with so many participants today, we may not be able to get to every question, but we'll get to as many as we can. We do have a link to the Q&A that we'll provide in the chat. You'll find answers to many common questions there. We will also compile a comprehensive report of the session, of all these sessions when they're done, and present a summary report to our commission at their next meeting, which will be on February 29th. And all of these materials, as I said, will be available on our website, mass.gov/GIC. I also just want to note, for those of you who wish to make a more lengthy statement rather than a question, or if you have questions about your specific coverage, we strongly encourage you to send us written comments via the phone number or the online contact form linked on the screen. This will also assist us in protecting your privacy, as this is a public session. So this year's annual enrollment will run from April 5th through May 3rd, very similar to most years. This is the period during which anyone who's eligible for GIC coverage can make changes to their insurance options. And this is all for coverage that will start on July 1st, 2024. So please mark your calendars. Immediately prior to the April 3rd date, you will have access to your benefit guides in time to make informed decisions during the annual enrollment. So a quick plug here, the GIC has been really hard at work to make it easier and more convenient for you to interact with us regarding your insurance options. As many of you likely know, we now have an online member portal called My GIC Link. Again, you can access that at mass.gov/GIC. All state and municipal active employees and retirees, if you have a valid email address, you can have access to the portal. There you can update your personal information, view your benefits at any time, and you can also learn about future information sessions such as this that we host. But you must register to use the portal, as it has to be a very secure website. So we encourage you all, if you've not yet registered, to do so by visiting the GIC website. So I'll start with a brief reminder of some important facts about the GIC. So as always, we start with our mission rather than read what's here on the slide. I'll just highlight a few key words. Of course, members. As always, you are and should always be at the heart of what we do. And I'm one who holds a belief that sometimes seems old-fashioned, that public service in any capacity is an honorable thing, and you deserve benefits that you can count on. So we honor that service, and we are here to serve you. So the other phrase to note here, high quality and affordable benefits. We're really seeking here to balance two really important objectives. We want to provide you with comprehensive benefits, but also at a cost that you and state and local government can afford. So a difficult balance that we try to strike, but both critically important to us. Again, quick reminder of the range of benefits that we offer at the GIC, not just health, but dental and vision, life insurance, long-term disability, and some other services. I do want to note that not all offerings are available to all GIC members. For instance, the GIC's flexible spending accounts, also known as FSAs, are only available to state active employees. But cities and towns frequently offer their own similar programs to their employees. Also, our employee assistance program, Mass for You, as is indicated by its name, employee, is provided only to active and state and municipal employees. Some key facts about the GIC: we have about 460,000 members, including 110,000 retirees. This makes us the largest purchaser of healthcare in the Commonwealth of Massachusetts, with an annual budget of about $2.5 billion. We are governed by a 17-member commission as a quasi-independent agency, and we partner with a wide array of state and local and regional entities in government. This slide briefly illustrates how GIC benefits are funded. The Commonwealth of Massachusetts, through annual appropriation, funds a significant share of your benefits. The cities and towns, for those of you who are employees there, they also, for those that purchase through the GIC, they fund a significant portion of your premium, highlighted in green. And of course, you, our members, also pay a portion of that premium, which in most cases is a deduction from your paycheck. So I don't want to get too into the weeds on this one, but I do want to note that GIC's health benefits are financed in a way that may be a little different than what many folks are used to. The GIC is self-insured, which means that we, through the state budget, hold the insurance risk for your benefits, not the insurance companies that you're enrolled in. So when you receive healthcare services, your doctor sends a bill to the insurance company that in turn pays the doctor. The insurance companies then bill the GIC on a weekly basis for all of those claims, and we in turn reimburse those insurance companies. An important implication of this is that over the course of the year, members, if members use more healthcare services than we expect, then the state pays that, but you, the members, do not have to pay any extra. Conversely, if members use fewer resources, fewer health services than we anticipate, the Commonwealth spends a little bit less than they would have expected to. So again, just a quick reminder before we move on that you may submit questions at any time during the presentation using the Q&A tab of Zoom. We will review those real time, get to as many of them as we can, but also note that the FAQ document linked in the chat also has lots of information about questions that you may have. And again, we want to protect your privacy. So if you have a question about your specific benefits, we strongly encourage you to send us written comments with the online contact form noted on the screen, or simply call us. All right, so with that, I want to move on and talk a little bit about our premium rates and our plan design for the coming fiscal year. So I'll start with premium rates. What we present here are preliminary numbers, as we will be working over the next 6 weeks or so to finalize them. But so the numbers that you see here may be slightly higher or lower than what we end up with at the end of the process, but this is our working estimate at the time. So unfortunately, we are looking at larger premium increases this year, more than we've had in recent past years. In the green box in the center of the slide, you will see that we are projecting an aggregate increase, average increase of 9.6%. This is a weighted average across all the GIC plans together. That's both Medicare and non-Medicare plans. So it's important to note that while that is an average, the premiums for specific plans will also vary. So 9.6 is the average, but certain plans may see increases higher than that. Certain plans will see increases that are lower than that. The key for you as our member, as you select your plans this year, as always, is to carefully evaluate the options that we have for you so that you can select the plan that most meets your needs. So I'll say a little bit more about why we're seeing these increases, what's driving that, But I first want to say a few words about changes to copayments and deductibles and make sure that you understand the steps in our process. So we understand that rising insurance premiums are a hardship for all of you. So we take this challenge very seriously. The challenges to healthcare affordability are very real, and they're increasing for the GIC and for everyone else. When the cost of healthcare goes up, the cost of premiums that pay for them also goes up. And that's driven largely by two dynamics. Number one, the prices that are charged by hospitals and doctors for the services that they provide, those are rising at a faster rate this year. And this is a problem that the entire state has to face. Also, the cost of prescription drugs is increasing at a faster rate this year as drug manufacturers command higher and higher prices, especially for new drugs that they are bringing to market. But these challenges are not unique to the GIC. Premiums are increasing, unfortunately, for everyone because these cost pressures are caused by broad challenges in the healthcare system, and we are one part of the healthcare system. That said, I am pleased to say that we are making no changes to plan design for the coming fiscal year. So copays and deductibles for our plans will be the same next year as they are today. This is driven by a longstanding preference at the Commission that we limit the year-to-year changes to cost sharing outside of the procurement years. We understand that navigating insurance can be difficult and confusing, so we want to try to avoid making substantial changes to copays and deductibles year after year. As you will recall, as part of our health benefit procurement last year, we had made some substantial changes to the vendors that we work with, the health insurance companies, but we also made a number of changes to copays and deductibles. As always, it is important to check with your health plan, the one you're in and any that you're considering, as provider networks sometimes change throughout the year. But I think the important takeaway here is that we are making no material changes to plan design. We have decided to keep things steady, allow our members to get accustomed to the changes that we approved last year. And then finally, in this section, just a review of our process. So we highlighted to our commission in December the projected increases to our premium and what the average would be. That was our first step. As we look 6 months into the future, as you can imagine, that has a good deal of uncertainty to it. The next step, which we did last week, was to recommend any plan design changes that we wanted to implement for the coming year. But as I noted in a previous slide, we've decided not to make any changes in this area. So a little bit different this year than it was last year. So the next step in the process is why we're here today. We want to come back to our members, inform you of what the plan design and rates will look like for the coming year. And finally, we will come back to our commission on February 29th, where the commission will vote on the premium rates for each individual health insurance plan that we offer. So this will all be brought together for you, as we always do, in the benefit guides and reflected on the My GIC link portal for annual enrollment. In this final section, we'll remind you about the insurance companies and other companies that we work with to provide you these benefits. They are also not changing for the coming year. So this is more of a reminder. So there are no changes to the companies that we work with to provide your pharmacy benefits. If you're on one of our active employee plans, CVS Caremark provides your benefits. And for those on our Medicare plans, it's CVS SilverScript that you've become accustomed to. So no changes to the plan, but as always, again, CVS may make changes to tiering of certain drugs and the drug formulary for next year. So it'll be important for you to, if you have any questions about your coverage there, to contact CVS Caremark or CVS SilverScripts. Similarly, the company that we moved to last year for our FSA, our flexible spending accounts, TASK, we will continue to work with them for our state employees. Next, I'll remind you of the companies that we're working with to provide your health insurance benefits. But before I do that, I do want to note that another of our health insurance plans has decided to change its name. So we really wanted to flag this for members early on in the process. Unicare, our longstanding partner at the GIC, is rebranding and changing its name to WellPoint. All of the names of the specific plans that you've been familiar with, Total Choice, Plus, Community Choice, and Medicare Extension, those will be staying the same. But Unicare has decided to change the overall name of the company. So the company will be sending members information about the name change in the coming month. So please keep an eye out for that. And if you continue on, for those of you who are in this plan, in the coming year, you will receive a new member ID card in the mail with the WellPoint name on it. So I just want to emphasize here, though, this is only a change in the company name. There are no other material changes to these plans. So that name change aside, as reflected here, there are no changes to the companies we work with to provide our non-Medicare plans. So you'll see regional network plans, our national network plan for those outside of New England, all of our broad network plans available across New England, and the limited network plans that are available in most of Massachusetts. So as I said before, with rising premiums, it's really important this year to evaluate your options and choose a plan that meets your needs. And similarly here, these are the companies we will continue to work with to provide your Medicare benefits. We have the Tufts Medicare Preferred Medicare Advantage plan available in most of Massachusetts, and then the national network plans on the left-hand side of the slide here. So before we move to the question and answer portion of this session, my staff have been watching the Q&A, and we will address a number of questions that you've asked there if we think they're applicable and of interest to the broader audience. But one more reminder that you may submit questions using the Q&A tab at any time during this session. And we'll review as many of those as we can and address them live in the Q&A function. So with that, we will conclude the formal presentation, and I will turn it to members of the GIC staff to flag for me any questions that we want to address verbally for the entire group.
Thanks, Matt. I'm just going to go to the questions that we pulled up here for verbal answer. And you may want to kick this to other members of the team, Matt, but I think one of the things we get asked most frequently is if you could explain what we need to do, what someone needs to do when they turn 65 and sign up for Medicare.
Yeah, so I'll hand this over to Paul Murphy, our Director of Operations, to speak to. I will note before he speaks that we do have a plethora of information on our website about what you need to think about and what you need to plan for as you're approaching your 65th birthday. So you may access that at mass.gov/GIC. But with that, I'll give the mic to Paul to say a few words about that.
Thanks, Matt. We also have a video for members turning 65, what to expect and how it works and how we notify you. So it's a very useful video on our website. But the general rule is if you are retired in turning age 65, GIC will contact you 3 months before your 65th birthday by letter, giving you the instructions on what you need to do to enroll in a Medicare supplemental plan with GIC. If you are eligible for Medicare Part A and Part B, state law requires you to join one of GIC's Medicare supplemental plans, and all of the plans will be outlined in that letter. Separately, you need to apply for your Medicare benefits, Part A and Part B, with Medicare directly. Once they approve you for the Medicare enrollment, GIC will enroll you in the Medicare plan that you select on the letter we send you. So it's pretty straightforward. We send you a letter 3 months before your 65th birthday. And if you are retired, the key is you have to be retired on GIC's records. Same rule applies to a spouse. If you're covering a spouse who turns age 65, your spouse will also receive the same information.
Thank you, Paul. The folks can also, if you look in the chat function, Director of Gov Affairs, Mike Berry, has been posting the link to the FAQs as well as the Turning 65 video that Paul just referenced. So it's available for you in the chat function and also on our website. Let's see here.
While you're looking at that, Erica, if I can ask Leslie to go to the dates for annual enrollment, I may have misspoken and caused some confusion about that. So annual enrollment will run from April 3rd through May 1st. My apologies.
Thanks, Matt. I see a question here just talking about the two different kinds of FSAs that we have, and also FSA as opposed to HSA, and why the GIC offers FSA but not HSA. So Matt, if you could speak or kick to another team member, one, why the GIC offers FSA and not HSA, and two, the two different types of FSAs that we do offer.
Yes, I think I'll turn that one to Jim Rust. We do offer two FSA plans. One is a healthcare FSA for a broad range of healthcare expenditures, and then a dependent care FSA for dependent care such as childcare expenses. Jim, is there anything you wanted to add to that? Or, I'm sorry, Cameron, maybe Cameron McBean on Jim's staff can say a word.
Yeah, I think that's the best place to go, Matt. Thanks.
Yep.
Yeah. As Matt mentioned, thank you, Matt. We do have two flexible spending accounts available to participate in. They are referred to in our documentation as the HCSA, which stands for Healthcare Savings Account, or the DCAP, or Dependent Care Assistance Plan. So this is a way to set aside money on a pre-tax basis via payroll deduction, and then you can use that money throughout the year to pay for your qualifying expenses. Now, it is an important distinction that when it comes to dependent care, that FSA plan is intended for child care expenses while you are working. That is not the plan if you want to cover, say, your kids' braces or medical expenses. That would still fall under the healthcare as savings account or the medical FSA. The GIC has never offered a medical plan that is compatible with a health savings account, which is a different animal and really more of a retirement savings vehicle, because those plans are what's known as first dollar plans, meaning that there are no copays associated. If you go to the doctor on an HSA compatible plan, you have to pay that provider's hourly rate rather than an office visit copay. And the same goes for any other covered expenses other than preventive care.
Yeah, and I will say more broadly about so an HSA is under federal law has to be paired with what Cameron described as it's a high deductible health plan. And we made the decision through the last procurement not to offer high deductible health plans. We're concerned that the member obligation through those plans is significantly high, and we wanted to be able to continue to offer the comprehensive coverage that the GIC has typically offered. Erica, we have others?
So we often get this question about the possibility of offering, instead of just family or individual coverage, individual plus one. I know we answered it a few times in the existing Q&A, but Matt, if you could speak to a little bit.
Yes, we get this question this time of year, most years, and we do continue to evaluate that option, but our evaluation to date really leads us to wanting to maintain the offerings that we have with family and individual, so as not to provide significant or introduce significant impacts on others' premiums here. So we do continue to look at that, but to date we've made the decision not to move in that direction. Jim, I don't know if there's anything more you wanted to add to that.
No, Matt, that's pretty much it. We do continue to look at it. So in order to provide the most benefit to the most members, it hasn't made sense for us to do so yet.
Thank you.
Thanks. We've gotten a couple questions about whether spouses can sign up for GIC portal access.
I would direct that question to Paul Murphy.
As far as the spouse having access, no, it's only available to the member. So it's a member benefit portal.
Thanks, Paul. Let's see here. We got a general question, just a little bit about the buyback program. If we could speak to it a bit, and maybe we can pop a link into the chat as well. But Matt, if you could tag in a member of the team for that.
Yep, I see Paul's left himself off mute, and I will turn it to Paul to talk about the buyback program. And Paul, if you can, I think your video is off. That may or may not be. So people can see your shiny face. Thank you.
Thanks, Matt. So the buyout program is offered twice a year through GIC, once during the open enrollment period and once in the fall. What the buyout allows a member to do is to buy out their GIC health insurance. So they cancel their health insurance effective June 30th or December 31st, depending on the buyout period. The member has to be enrolled in a GIC health plan on January 1st through June 30th for the open enrollment buyout, or July 1st through December 31st for the fall buyout. Once the member cancels their coverage and applies for the buyout, GIC will send a check to the retiree. If you're an active employee, a reimbursement will come through your payroll system for 25% of the full cost premium monthly for 12 months. So it's only a one-time deal for 12 months. It's 25% of the full cost premium. You must have insurance coverage on January 1st for the buyout during open enrollment and July 1st for the buyout during the fall. As a member, you are required to maintain your basic life insurance policy during the buyout. And again, it's only for 12 months.
Thanks, Paul. We've gotten a few questions about the upcoming change in the waiting period for newly hired employees. Matt, I assume you want to give it to me, but
Yeah, I'll say a word about that. So this wouldn't apply to anybody who's here on this webinar if you're already covered through the GIC. If you are, you may recall when you joined state service, there was a waiting period of on average about 60 days for coverage to begin. We understand that has been a hardship for our members, and have taken some important steps to reduce that waiting period. Really what we're trying to do is eliminate the gap in coverage so that individuals, as they leave private sector coverage or any other coverage that they may have when they come here, they don't have to experience that gap in coverage. So we're really excited about this. It's been something that we've been working on at the GIC for a number of years. So starting on July 1st of this coming year, any new employee that comes in will be subject to a new set of rules that will really, we hope, close that gap to zero gaps in coverage for them when they join the GIC. Erica, you've been doing a lot of work on this for the team. If there's anything that I left out there, please chime in.
no, I think the key thing to remember here, especially for those of you who are on this call who are GIC coordinators or HR professionals, is that this change in rules will be effective on July 1 of this year. Employees who are newly hired will be eligible to sign up for GIC, or will be eligible for benefits on the first of the month following their date of hire, unless that person's date of hire is the first of the month, in which case they would be eligible immediately. So those are the key things to remember there. And there will be more information coming out about this and how we intend to make those changes in the coming months. But again, if you are a present member, of the GIC, this does not apply to you. And so, you can kind of wipe that piece from your memory only if you're going to be a newly hired employee. So let's see the next questions. Let's see here. We did ask if we could just hop back to the provider slide quickly, if that would be possible. And we did get a question about a little bit about the procurement from last year and moving from Express Scripts to CVS, and just about kind of how that process worked. I think it might be helpful to just shed a little light on the procurement process and how we kind of wound up with CVS as opposed to Express Scripts.
So for that, I will turn to Jim Rust, who's in addition to being our CFO, is also oversees the vendor management and procurement teams, to say a word or two there. And so, Jim.
Thanks, Matt. Every 5 years, the GIC is required to procure new vendors for all our benefits. So every time something comes up, including pharmacy, healthcare, dental, and so on. So we do this in accordance to all state laws and policies for procurement law and procurement regulations. So we put out an RFR for vendors to respond to, and then that RFR is scored by a procurement team that It looks for things like best value, quality of the benefit being offered, and all those kinds of things. And that process goes on for something as complicated as pharmacy for just about a whole year. And at that time, CVS was the winning bidder. We negotiated a contract with CVS that brings the best value to the members. And overall, I know other than some members having some issues with things like prior authorizations and things like that that needed to go over, we've been pretty happy with the transition to CVS. The benefit itself is unchanged for the most part, and the value to the Commonwealth and the members was increased during that process. So that's a high-level overview of how the process works. But Matt, I don't know if you had any specifics you wanted to touch on as well.
No, just to acknowledge that whenever we change vendors, we don't do so lightly, right? And we understand that for you, it represents getting used to a different company. You have a different card, new phone number, and the transition has some issues that we work closely with our vendors to make sure it's as smooth as possible for you. But the procurement, I just want to emphasize that the procurement is an opportunity for us to make sure that we're getting the best value for your money and for the Commonwealth's money in providing you the benefits that we do. And we do that on the health plan side, we do it on the pharmacy side. And Jim talked through the process that we go through to do that.
Thank you. I'm just scrolling through to make sure we get the right questions. Let's see here. Is insurance available for an employee who deferred their retirement for a few years?
So that's another good question for Paul Murphy, our Director of Operations. Paul?
Thanks, Erica. Thanks, Matt. If you have deferred your retirement and you do not have GIC coverage and you decide to collect your pension check at a later date, the retirement and collecting that pension at a later date is a qualifying event for you to enroll in GIC coverage. So if you're going to defer your retirement and start collecting it, for example, in December of 24, that is a requirement that you can collect your pension check and enroll in GIC benefits at the time you file for retirement in December of 24. So that is a qualifying event for you to enroll in benefits once you file for that retirement.
Thanks, Paul.
Thank you. We got a question about just talking briefly about survivor benefits and the process when a spouse passes away.
That's another one for Paul Murphy.
GIC does offer survivor health benefits when a member or a retiree passes away. The requirement for the survivor benefit, as long as the member or the retiree is covered with GIC benefits at the time of death, the GIC will offer surviving spouse coverage to the surviving spouse. So one thing to note here is that many times we get questions on whether people have take the various options with the retirement system. They take option A for their full benefit, option B for the survivor benefit, etc. That has no bearing on the eligibility for survivor health coverage with GIC. We don't care what option you took on the pension side. The only requirement is that if the member or retiree is covered with GIC benefits at the time of death, we offer survivor health coverage to the surviving spouse as long as there is a surviving spouse. It does not apply to someone who is divorced covering an ex-spouse. So survivor is only available to the surviving spouse, not the ex-spouse. If you are going to receive a survivor pension, GIC will take the premiums from the survivor pension monthly to pay for the coverage. If there is no surviving pension left by the retiree, then GIC will bill the surviving spouse quarterly for their benefits.
Thank you, Paul. Matt, we're getting quite a few questions about when new rates will go into effect.
So the new rates will go into effect for coverage starting on July 1st of this year, 2024.
Thank you. We also wanted to talk a little bit about reminding Medicare retirees about some of the impacts of signing up for private or commercial supplements, you know, in terms of it canceling their GIC coverage. So Matt or Paul, if you could speak to that a little bit, just to make sure our members are well informed about those consequences.
Yeah, you'll see all the ads on TV. I believe it's towards the end of the calendar year, if I'm not mistaken, for kind of private individual Medicare Advantage type coverage. The GIC offers excellent Medicare benefits, and we strongly encourage our members to continue to have their coverage through the GIC. Paul, I don't know if there's anything more you wanted to add to that.
No, I think that covers it, Matt. Just one thing to note, that if you do join one of those plans, all of the GIC coverage ends on our end. So we have a lot of people that join, like in the Medicare open enrollment that takes place in December. They just need to keep in mind that all of the benefits with GIC end at that time by joining another Medicare supplemental plan outside of the state.
Thank you, Paul. Just scrolling here for additional questions. One moment, please.
Erica, if you want, I see a lot of questions on, again, turning age 65, but if a member continues working for the state after 65, while you're looking, I can address that issue if you want.
Sure, that would be great. And I'm seeing that perhaps our chats that have the links in them aren't showing up. So we'll work to make sure that those are available as well. But go ahead.
Sure. So one of the examples I gave earlier, we described a retiree who's turning age 65, covering a spouse who may also be turning 65, gets a letter from GIC if they are retired. We do get a lot of questions from members that are turning 65 or their spouse is turning 65. The one thing to note here is if you, the member, is going to continue working for the Commonwealth after age 65, and you are covering a spouse, there is no need to enroll in Medicare Part A and Part B if you're going to continue working for the Commonwealth after age 65. You simply stay in the plan that you have at age 65. So if you're covered, say, for example, in the Unicare Plus plan, you can continue that plan after age 65, and you do not need to enroll in Medicare. Same rule applies to your spouse. If you decide to retire in the future after age 65, when you file for retirement, that's when GIC will want you to go back and apply for your Medicare Part A and Part B. There's a 7-month window with Social Security or Medicare to enroll in Medicare A and B after you retire. But if you're going to continue working after age 65, there's no need to enroll. Your spouse does not need to enroll. You simply stay in the plan that GIC offers until such time you retire.
Thank you, Paul. So here's a general question. If you're satisfied with the plan you currently have, do I need to complete a new annual or new enrollment paperwork?
No, you don't. In short, I would say, though, that it's always good practice to evaluate your options, even if you do decide at the end of the day to stay with the plan that you cover, that currently covers you, it may be that a very similar plan is available at a lower premium.
Thanks, Matt. Another question is how does a member find out who their coordinator, their GIC coordinator is?
I think I'll turn that to Paul.
So on our website, mass.gov/GIC, there is a section on the website called Who is my GIC Coordinator? And that lists all of the agencies, the addresses, the coordinator's phone number, and email. So we publish that and update it every month on our website. So you just need to search for Who is my GIC Coordinator? And you'll pull up a spreadsheet and you can look up your agency there and it'll give you the information.
Great, thank you. If my spouse's company offers family insurance coverage, would I be eligible for a buyout? The person is unclear when an employee is eligible for the buyout program.
I think that's another Paul Murphy question.
So the buyout, as I stated earlier, is available during open enrollment. I'll give you an example for this year. So during open enrollment, you can apply for the buyout. It's a separate application. It's a paper application on our website or through the member portal. You, the member, have to have coverage on January 1st of 2024 through June 30th of 2024. If the plan that you are going to be enrolled in is through a private employer, not Mass Health and not another state employee, you are eligible for the buyout. And you will get a check for 12 months, 25% of the full cost premium from July 1st through June 30th of next year. So if it's a private employer that you're going to hop on their insurance, you apply for the buyout during the open enrollment period. Same thing happens in the fall. Many employers have a calendar year benefit, January through December. So if you're going to hop on your spouse's private employer insurance in the fall, same rules. You have to have coverage on July 1st, 2024 through December 31st, and you can apply for the buyout effective January 1st of 2025.
Thanks, Paul. I'm seeing a few more questions around from GIC coordinators around the reduction of the waiting period process in terms of how the first month of premiums will be paid. Matt, I can go ahead and answer that unless you'd like to take a first stab at it.
No, that's fine. If you can go ahead, and I just would note, and you probably say something that you would have said anyway. I mean, there'll be a lot more communication and resources and training available to our GIC coordinators on this topic. So many of the questions that you have are good ones, and we'll have other opportunities to answer them.
Great. So great question from GIC coordinators about kind of that first month premium. The process will be that the GIC will bill for that first month. And again, as Matt mentioned, more information, more context for these changes coming as we continue to make the changes on our end. I also saw a question here regarding the start date of this new rule. That's going to be a hard and fast date of July 1, 2024. Anyone hired before July 1, 2024 will still have the 60-day waiting period. Anyone hired after that will be the reduced waiting period. Let's see here, a couple other questions. Here. It looks like our Q&A has slowed a little bit in terms of the new questions. We do have quite a few questions in here that are pretty personal in nature and pretty specific. So Matt, if you might reiterate some of our guidance from earlier.
Yeah, and maybe Leslie, there you go, perfect. So many of the questions that you have are likely very specific to you and unique circumstances. And it's hard for us to use this platform to respond to each and every one of those. So really would encourage folks to get in touch with us through the online form that you see noted here on the slide. That in the bottom box there bolded, or to give us a call. But really using that online form is probably the best way for us to get you the specific answer to your question.
Great. I'm also seeing a few questions still around the new waiting period, around whether or not whether they'll still have the 21 days to enroll. The answer is yes. We'll still have those 21 days. Sorry, I see another question coming through. A couple of new questions. So again, another question just asking to reiterate when the new rates will be published. And I think
probably a question for Paul for those. It will be so the commission meeting that we have on the 29th of February will be the date at which the premium for each individual plan will be voted on. But there's a process that we go through after that before we can make really all the applicable premium rates available to our members and included in our documents. Paul, you want to speak to that?
Sure. What happens is once the rates are voted by the commission, our staff at GIC have to work many different tables of the different rates that we offer. We have multiple contributions, particularly around retirees, which is 10 or 15 or 20%, and the active employees 20 or 25%. So we go through this process of updating all of our rate information that's on our website, the benefit decision guide, and rate charts that we make available to GIC coordinators so they can share it with their employees. So it does take a couple of weeks after the rates are voted for us to finalize all of those calculations. But we will have the information available, I would say, towards the third week in March, right before the annual enrollment starts. And again, they will be in the benefit guides. We will have the rates in the portal at the start of annual enrollment, and coordinators would have received rate charts with all of the different contributions so that they can distribute to the employees. But it does take a couple of weeks from the vote for us to get all these contributions calculated and set up on our website, et cetera.
Thanks, Paul. I see one kind of comment here about the Q&A process happening on this session. And ask that we add some of these to the FAQs on our GIC website. We will do that. That is how we build out the FAQ, is often from these sessions. So we will go ahead and process these questions following all three of the sessions that we have, and we'll update the FAQs based on that. We had another question here. Let me just go back and find it. Around the buyback option. Is the buyback option offered one time, or can I continue to assess the cost of each plan offered by my spouse's plan versus my plan year to year?
It's another question for Paul.
Buyout is offered one time, 12-month premiums. You have to remember that you have to be enrolled in GIC coverage for the 6 months immediately prior to the effective date of the buyout. So as I said earlier, you have to be January through June to get the July buyout, July through December to get the January 1st buyout. So that is the qualification. So it's a one-time deal, 12 months. After that, there is no additional buyout because the member or the retiree will not be enrolled in GIC coverage. So it's only a one-time deal. If sometime in the future, the member or the retiree enrolls in GIC benefits during an open enrollment period, They could become eligible for a future buyout as long as they have that criteria. They had GIC coverage for the 6 months immediately prior to the buyout. So it does change, but it can possibly be eligible in the future, but you've got to have that 6 months prior to the buyout to be eligible. It will not allow you to continue to get a buyout every year because you've canceled your coverage and there's nothing to buy out of. And buyout is also not available to new employees. We do get that question a lot. The reason is you have to have that coverage 6 months before with GIC. So it does impact new employees can't get the buyout until the following annual enrollment.
Thank you, Paul. We had a clarifying question. Someone asked if you could, if you turn 65 and are still working, do you need to sign up for Medicare? There was, I think, a little bit of a conflict in what was said verbally and what was answered in the Q&A. So, Paul, if you could clarify, and the question is,
So,
if you turn 65 and are still working, do you need to sign up for Medicare?
right. So as I stated earlier, if you are going to continue working after age 65, and this applies if you're covering a spouse under your plan, Medicare has two parts, Part A and Part B. If you're going to continue working after age 65, you can enroll in Medicare Part A. It's free, there's no monthly premium, but you are not required to enroll in Part A if you're going to continue working. So some people choose to enroll in Medicare Part A, some people do not enroll in Medicare Part A. It's totally up to the member. The one thing we don't want you to do is if you're going to continue working after age 65 and you are covering a spouse, do not enroll in the Medicare Part B. Medicare Part B is going to have a monthly premium of $170 as a base rate per month. And there is no need to enroll in Medicare Part B if you're going to continue working because your GIC health coverage is primary while you are working. So you simply can defer the enrollment in Medicare Part B after age 65, and if you're going to retire at a later date. If you are age 65, you or your spouse, and you are retired, you must enroll in Medicare Part A and Part B. But if you're going to continue working, the Part A is up to you. You can enroll in it. You do not need to. If you choose not to, there's no penalty. The only time Social Security will penalize you is that if you don't sign up for Medicare Part B when you are first eligible and you decide to do it at a later date, there is a penalty for the Medicare Part B enrollment. But if you're going to continue working, you don't need to worry about the penalty. It doesn't apply.
Thank you. Forgive me if we've already asked this question. There's a lot of questions flying around, but can a post-retiree who has paused their pension sign up for GIC coverage?
The paused has got me, I'm not sure what the member means by pausing their pension. So there are some retirees at the Commonwealth who decide to come back to work for the Commonwealth after they retire, and they put their pension on hold. In cases like that, if the member puts the pension on hold and come back to work for the Commonwealth, they would get benefits through the state agency or municipality where they're working, as long as they're in an eligible benefited position. If somebody has just decided to leave work and not collect a pension, and that's what you mean by pausing till a later date, that's fine. You do qualify for GIC health coverage when you file for retirement to collect that pension. So that is retirement, and it is a qualifying event to enroll. So I sort of give you two answers there because I'm not sure what the word paused means, but it has different meanings depending on which way you're looking at it. If you're not collecting a pension, you do it at a later date, you can come in at that time. If you're coming back to work for the Commonwealth and pausing your pension, you would then get benefits as an active employee because you can't have them as a retiree.
you, Paul. Another question, when you retire, let me just make sure I'm saying it correctly. When you retire, is your life insurance still active?
So the member is the one enrolled in life insurance. We do not offer life insurance to any spouse or dependent, just to be clear. So you as the member, if you have health coverage with the GIC, you are automatically still enrolled in a basic life insurance policy of $5,000. The state also offers supplemental optional life insurance. If you have the optional supplemental life insurance at the time you are filing for retirement, you do have the option to continue the life insurance into retirement. Now, the rates get expensive on the optional life insurance, and we encourage people to look at those premiums when you're filing your retirement paperwork because it does get expensive. So there is a rate automatically for anyone who retires under age 70, and it's per thousand per thousand, whether you're a smoker or non-smoker. If you keep the life insurance after age 70, every 5 years thereafter, the coverage on your life insurance premium does increase. GIC does send the retiree a letter warning you of the increase in premium, and you can decrease or cancel that coverage anytime throughout the year. It is a term life insurance policy. There's no cash surrender value. But if you want to continue it, you can do so, but you have to be enrolled in the optional life insurance at retirement to continue it. But it does get expensive, and we urge members to look at that cost. And GIC does send you that letter as a warning, so we just don't take that premium from your check.
Okay, thank you. Let's see. So in terms of questions to be answered live, I've seen it slow down a bit in the GIC chat. And again, I see a lot of kind of personal questions in the Q&A and would encourage folks to note the items on the screen here to get in contact with us. Matt, was there anything else that you wanted to add?
I don't think so. We're certainly grateful for those of you who have joined us here for the session. It's an excellent opportunity, I think, for us to inform you about the plans and the rates as we get close to the coming annual enrollment. As is often the case in insurance, so many things are kind of situation specific to you as a member, and I think those are the kinds of questions that you're referring to, Erica, in the Q&A. And I would just encourage folks on those to just reach out to us directly. We can help you. We've got a team here, willing and able and eager to help you. Lots of questions, as we always get, about Medicare, and particularly around the transition when folks are getting ready to be eligible. We've got an excellent team of people who really know the ins and outs of all the things that you need to be aware of. So I would say reach out to us directly. We're here to serve you and look forward to doing so. You're on mute.
Sorry, thank you. So there are still some, like I said, questions hanging out here in the Q&A section. Some of them being personal in nature, some of them require more than just a quick answer in the Q&A. And so I would, as Matt mentioned, if they're personal in nature, please get in contact with us. And if they're one of those questions that require a little bit more than just a quick answer in the Q&A, we will be updating our Q&A, or I'm sorry, our FAQ document, and getting it out to folks. So So just please keep an eye out for that. I'm looking in our chat here and I don't see anything else. Those of you who are eager to find out more about this, the reduced waiting period, please keep an eye on your email inboxes as more information will be coming to you shortly.
So we're going to wrap up then. Okay, I want to thank everybody for joining. We really get, I hope the information we provide, both through the presentation and the Q&A, is helpful. We really appreciate everyone coming out for this. But please keep an eye too on our website. Loads of information there that can help you make informed decisions. So thank you all. Thank you all for putting your trust in us. And we're honored to be able to serve you as servants to the state and the municipalities that you work for. So thanks for joining us.